Today's speech is to inform and educate my audience about chronic kidney disease and its symptoms and signs and other available treatments, if available. Did you know that 30 million Americans are diagnosed with chronic kidney disease, as well as millions of others are increased at risk as well? I'm sure some of you may know someone in your family or someone that's close to you that has chronic kidney disease or has been had some type of chronic kidney injury. I know I personally do, someone very close to me, and it's a very sad disease. It's very debilitating. But there are some facts about chronic kidney disease that I would like to share with you, along with the signs and symptoms to look for, along with some of the treatments that may be available if you or someone you know may be diagnosed with this terrible disease. One fact is heart disease is a major cause of death for all people with chronic kidney disease. There is hypertension that also causes chronic kidney disease, but chronic kidney disease can also cause hypertension, which is high blood pressure. Persistent protein in your urine means you have chronic kidney disease, that it is present. High-risk groups include those with diabetes, hypertension, family history of kidney failure. Those, along with African Americans, Hispanic, Pacific Islanders, American Indians, and seniors, are increased at risk. Chronic kidney disease is a condition characterized by gradual loss of kidney function over time. Early detection can help prevent the progression of kidney disease to prevent kidney failure. Some risk factors for chronic kidney disease could be autoimmune disease, diabetes 1 and 2, exposure to certain chemicals, and environmental conditions such as lead, mercury, uranium, arsenic, exposure to certain drugs, family history of chronic kidney disease, hypertension, as we said earlier, low birth weight, low income or education can contribute, lower urinary tract obstruction, minority status, which is your race, which is African American, Indian, Asians, neoplasia, nephrolithasis, older age, recovery from acute kidney injury, reduction in kidney mass, systematic infections, and urinary tract infections. Two main causes of chronic kidney disease, however, are the diabetes and hypertension. 2/3 of these cases are because of these two chronic conditions. They can cause inflammation and damage the kidneys' filtering agents. These disorders are third most common type of diseases. Some of them can be inherited, which cause large cysts form in the kidneys and damage the surrounding tissue, which could be polycystic chronic kidney disease. Obstructions caused by problems like kidney stones, tumors, or even enlarged prostate glands in men. Also, like we said earlier, urinary tract infections. If they're left untreated, the urine can get backed up into your bladder, which your bladder can get backed up, back up into your kidneys, which is on both sides of your spine. Most people are born with 2 kidneys. Some are not. I know people personally that were born with only 1, and they are currently in chronic kidney disease and failure right now. So these are very important symptoms to look for if you think you or someone may have chronic kidney disease. If you're feeling tired or have less energy, have trouble concentrating, have poor appetite, have trouble sleeping, muscle cramps, at night mainly, swollen feet and ankles, puffiness around your eyes, especially in the morning time after you get up, have dry and itchy skin, very, very itchy skin, and you find yourself urinating more than often, typically at night. Um, Anyone at any age can get chronic kidney disease. Some people are more likely than others to develop this disease. You may have an increased risk if you belong to a population of group of people in your family that have diabetes, high blood pressure. The one thing that doctors can test to see if your kidneys are functioning correctly would be your glomerular filtration rate, which is also called GFR. And this can be checked in your blood or by a blood sample. And there's usually a range, and they can tell whether or not your kidneys are functioning correctly. And if not, then that's when they go and they do further testing to see what's going on and run further blood tests as well. You can also have a kidney biopsy done to see what type of kidney failure you do have. Some people have acute and chronic. Acute is considered anything less than 3 months diagnosed. Anything over 3 months, you're considered chronic. Chronic kidney disease can be lessened. It can be taken care of if you pay attention to your diet, if you take your meds like you're supposed to. Any type of symptoms that I listed earlier or I stated earlier, stay on top of those type of things, because it's very important that you report to your doctor if you're having any of those symptoms, because if you can get this diagnosed sooner than later, then this can be lessened because it cannot be cured. The only treatments that are out there available for people with kidney failure are prescription drugs, along with dialysis, and also the last resort, which is transplantation, which is needing a donor to donate a kidney. I do know that there are over 100,000 people that are on the transplant list here in Augusta, Georgia, at Augusta University, that are waiting for donors. If you or anyone you know may want to donate a kidney to someone in need, get out there, save a life, because this is a disease that is very debilitating, and it's up there with heart disease, and it's killing people. And people on dialysis, stay on dialysis until they either get a kidney or they pass away. So this is a very important disease, and in our today's society, it is important that you are aware of all the signs and symptoms of this debilitating disease. And I hope you find my speech today very informative. And if you or someone you know is experiencing any of this, please contact your medical physician or someone in maybe a group setting that can possibly help you, and they'll get you the help that you need. Thanks, guys.